The question that I get asked almost every day about rotator cuff tears is, do I really need to have surgery? This is what I tell my patients. No, you don't have to have surgery, but it is important to keep an eye on the tear. So if the tear is small and you're able to cope and manage with it relatively well and it's not changing your lifestyle, then it's okay to not have surgery. How do you keep an eye on the tear? Well, it's good to follow up with someone like myself. I tell my patients, come on back in 3 to 6 months to have a surveillance MRI, just to make sure that you're not one of those that happens to have a silent progressive tear. You might need an MRI just to double check to make sure that indeed it's not getting a lot worse, because a large tear or a super large tear is harder to treat. It's okay to not have surgery, especially if it's a relatively small tear, because tears act like zippers. If one of your zippers, like your pants zipper, is just a little open, the chance that it actually opens up further is much less than if the zipper is halfway open. Then it just unzips much easier, right? And that's how a tear is. If you have a small tear, the chance that it becomes that it progresses or becomes larger is much smaller than if you have a large rotator cuff tear. I hope you found this information on rotator cuff tears educational. Comments or questions, drop them below. And don't forget, your health is in your hands, and I'm here to provide educational material to help you make better treatment decisions.